Final backbench contribution, James Naish.
Thank you, Madam Deputy Speaker. I appreciate being called. And just before I begin my main speech, I do want to reference my honourable friend for Worthing West. She mentioned coastal communities, and she's absolutely right to do so. May I also reference rural communities, because there are equally challenges in delivering healthcare to that particular demographic. Let me start with some good news for my constituents. Last year, Nottingham University Hospitals was named among the 10 most improved trusts in England for 4-hour A&E performance and 6th nationally on 12-hour waits. That is not a small thing. It reflects genuine hard graft by staff at the Queen's Medical Centre and City Hospital, and it earned the Trust a share of a £3 million reinvestment fund from NHS England. It sounds good. But I would be doing my constituents a disservice if I stood here and pretended that the job was done. Because just over a week ago, on the 29th of June, NUH declared a critical incident after the recent extreme heat drove demand across the Trust far beyond what its emergency department could safely absorb. What's more, this was the 4th critical incident of the past year. At its worst, in the latest incident, there were 188 patients in the emergency department and 20 ambulances queuing outside. Patients were experiencing lengthy waits on corridors, and more people than expected were medically fit but unable to be discharged. I recently asked the government about this, and the Minister's response was clear. They said corridor care was, quote, unacceptable and should never become normal practice. But, Madam Deputy Speaker, this shouldn't even need saying, and it's only after 14 years of drift that it did. What matters now is action, and the government has for the first time published a national definition of corridor care and started daily reporting so that trusts can no longer hide the problem, and neither can we here in this place. That transparency, thankfully, is being backed by some new money. Over £450 million is going into urgent and emergency care capacity this year alone, and £215 million of capital funding is delivering 40 new and expanded urgent care sites across England. Locally, for my constituents, this means two things which I genuinely welcome: confirmed funding for an expanded urgent treatment centre at QMC, and a trust-funded reconfiguration of the emergency department, because our Chief Executive has found the money internally to get on with it now, rather than wait. I was particularly pleased to be able to tell this to one of my constituents, Renee, after she contacted me to tell me about her experience in A&E. As a lady in her 70s with a long-established heart condition for which she has ongoing consultant care, she found herself after a heart attack spending 9 hours waiting for care in A&E for a condition which should have been seen immediately. Nationally, Madam Deputy Speaker, A&E waiting times are at their best level in 5 years, and elective waiting lists are at their lowest in 3.5 years. That is progress, but it will ultimately count for nothing in Rushcliffe if a bad winter, a system failure, or a staffing gap can still tip a good department into crisis extremely quickly. So, Madam Deputy Speaker, my ask of the Minister is simple. Keep the funding for urgent and emergency care, keep the pressure on trusts that are lagging behind, and keep listening to backbenchers who are hearing from doctors and from constituents at our surgeries regularly.